These 5 medications should live rent-free in your head if you are a nursing student. And I also have Nclex review on most tested medications on my YouTube channel at Scrub and Spoon. Go review that. Now let's go. The first medication is lithium. Now, lithium is used for bipolar disorder. It is a long-term treatment for bipolar disorder, and lithium is a mood stabilizer. Remember, lithium have a narrow therapeutic range, which is 0.6 to 1.2. Anything over 1.3 is toxic, okay? And patients that are at risk of getting lithium toxicity are patients with kidney dysfunction, patients with dehydration, and patients that have hyponatremia, okay? Low sodium. Creatine level is the most acute way to know about kidney function, right? And creatine level of over 1.3 shows that the kidney is bad. And if your patients have urine of 30 mils per hour or less, it signifies that the kidney is in distress. And so this puts this kind of patient at greater risk of lithium toxicity. Also, I need you to know that blood level is drawn regularly to monitor and maintain therapeutic dose of lithium. Now, just like I said, that hyponatremia, which is low sodium, will cause lithium toxicity. So do not limit sodium in patients taking lithium to avoid lithium toxicity. And also encourage fluids. Hydration is needed in patients taking lithium because dehydration would also increase the risk of lithium toxicity. Now, encourage your patients to drink at least 1 to 3 liters of water daily to avoid dehydration, and they should limit diuretics. If they are on diuretics, you need to either talk to the provider because you lose fluids when you are on diuretics like furosemide. So you need to talk to the provider because we don't want them dehydrated. And also encourage the patient to avoid drinks that have diuretics property, like coffee, like caffeines, like tea, and also cola, okay? Now, signs and symptoms of lithium toxicity includes tremor, confusion, GI upset, ataxia, and may also cause seizure, okay? A common side effect of lithium is dry mouth, okay? So you see why you have to encourage fluids, drowsiness and fatigue. So you see, when they are taking lithium, they should avoid operating heavy machinery until they know how this lithium affects their body or makes them feel, because they can feel drowsy when they're on lithium. Lastly, lithium can also cause weight gain, so they should monitor their weight. So always remember to monitor sodium level and encourage hydration when the patient is on lithium to avoid lithium toxicity. Now, the next medication is albuterol, which is Ventolin. This is a short-acting beta-2 agonist. Now, albuterol is used for asthma, COPD, bronchospasm. Remember, albuterol is a rescue inhaler, meaning it is the fastest acting bronchodilators, and it is the first drug you give during asthma attack before giving steroid inhalers. And side effects of albuterol includes tachycardia, nervousness, tremor, chest pain sometimes. Now, this is some nursing tips or nursing consideration. Albuterol is used before steroid inhaler. You have to wait 1 to 2 minutes in between puffs, and you have to assess lung sound before and after using albuterol. Now, the next medication is enoxaparin, which is an anticoagulant. Now, enoxaparin is a low molecular weight heparin, and it is used for DVT, right? Pulmonary embolism, and it is also used to prevent blood clot post-surgery. Now, some side effects of enoxaparin includes risk of bleeding, right? Since it slows down coagulation, it puts patients at higher risk of bleeding, right? Also bruising. It can also cause GI upsets like nausea, vomiting, diarrhea, okay? So monitor that. Also monitor for hematuria, that is blood in the urine. Black stool, because black stool suggests upper GI bleeding, right? So monitor for black stool, and also monitor for their gum to see if it's bleeding. And lastly, be careful giving this to patients with renal impairments. Okay, now the next one is vancomycin. Now this is a glycopeptide antibiotics and it is very toxic, so you have to be careful with it. This can be very toxic to the kidney, that is nephrotoxicity, and it can be toxic to the ear also, that is ototoxicity. Okay, and remember, you have to monitor vancomycin concentration level in the blood, because too high vancomycin, the kidney will die, and too low vancomycin level concentration level, infection will grow. Remember that too high, the kidney will die, and too low, infection will grow. And you have to check this 15 to 30 minutes before the scheduled next dose or before administration. Okay, and the therapeutic range is 10 to 20. Now, signs and symptoms of vancomycin toxicity is ototoxicity, that is damage of the ear, or toxicity to the ear. It's loss of balance. It can also cause tinnitus, that is ringing in the ear. Like I said, it can cause nephrotoxicity, so you have to monitor creatinine level. Now remember this, Nclex wording: avoid rapid infusion of vancomycin, that is never infuse vancomycin very fast. Why? Because it will cause red man syndrome. Nclex wording. And what is red man syndrome? Red man syndrome is like sudden severe hypotension, itching, red rash on the face and neck, chest, and the extremities. Now remember this is not sign of vancomycin toxicity. This is just side effect of rapid infusion of vancomycin. Remember, it also burns the vein, so it has to be given slowly over 16 minutes through IV. So things to monitor for while your patient is on vancomycin: remember, monitor their blood pressure. Okay, monitor the BUN and the creatinine level. Okay, monitor the throat level of vancomycin in the blood, right? And report tinnitus or hearing loss immediately. Okay, guys, and the last one is prednisone. This is a corticosteroid. Now remember that steroids is a stress and swelling hormone, and steroids suppresses the immune system, causing the risk of infection. Now prednisone is used for asthma, COPD, rheumatoid arthritis, and psoriasis. Okay, and steroids helps the body to respond to inflammation and stress. Now for the side effects, remember that long-term use of steroids will cause serious side effects such as weight gain. When people that are on steroids are gaining weight, they are gaining water weight, and that is when you see the moon face. Long-term use of steroids can cause that. Like I've mentioned earlier, they are also at risk of infection because of the reduced white blood cell. Like I said, that steroids can suppress the immune system, so they may experience slow wound healing. Another side effect is hyperglycemia. Steroids increase blood glucose, and when this happens, we also increase insulin to lower the blood glucose. Another noticeable side effect of steroids is osteoporosis and mood swing. And remember guys, you do not stop any medication abruptly, including steroids. You don't stop them abruptly, you taper them off. You don't stop abruptly or suddenly. And also remember to encourage your patient to take it with food to avoid GI upset. And that's about it guys. Take care.